Well, good morning or good afternoon, depending on when you're hearing this. This is Arnie Thompson, and we are trying a second time to do a chat update. It's being brought to you through our new program, product, if you will, called Care Merge, which we rolled out about 4 or 6 weeks ago. And as the team continues to learn about all the capabilities that this software does, we're excited to roll out some more things as it relates to our dining menus, activity programs, various things. So please continue to be patient with us as we learn more about this. But this is coming through our in-house channel. And so I am doing this through a Zoom recording. So I have limited time, I think 40 minutes. And for those that know me, 40 minutes, I can fill up 40 minutes by just telling you my name. But I want to get you up to date on some things that's been going on here at Friends Homes. And the first thing I'd like to start out with is COVID-19 update. And you are aware, since this is going out to both West and Guilford, I know some may be aware, some may not, but at West, back in May, I think Donna made us aware that we did have a part-time employee that did test positive for COVID-19. We did some testing and didn't find anything. Everybody was negative. We reported that to the health department as required. And then sometime around mid-June, we became aware of another employee in our health center who tested positive for COVID-19. And working with our medical director in the health department, we decided to do additional testing. And when we did that, we found that we had one employee, I'm sorry, we already knew about the one employee, but we had one resident that tested positive for COVID-19. They were asymptomatic, which meant that they had the virus, but they were not showing any signs or symptoms, which is a good thing. But once we found that out, again, the health department, medical director, we expanded our testing to do about 150, 160 additional tests. And the good news is everything came back negative, except for that one resident who is still asymptomatic. And I think within the last week, we received the all clear from the Department of Health as well as our medical director. So we're no longer on a quarantine. Now, I will tell you that depending on where you go, you will still see West will still show 3 cases of COVID-19. And the reason why is that until you've gone a full 28 days without any cases, they will continue to show data. So those are the 3 cases that have happened. But right now we're in the all clear, and knock on wood, we'll stay that way. Now, this past weekend, we did become aware on our Guilford campus, in our health center, in particular in assisted living, we had a resident that fell. And when they were sent out to the hospital, they did, as their protocol requires, a COVID-19 test, and the resident did test positive for COVID-19. And so with that, we're doing additional testing right now for our residents and staff that are in Fry. If you recall, we do have the quarantine unit in Fry. Those people are kind of segregated from the general resident population. Additional PPE, personal protective equipment is utilized. So those tests were started yesterday, being done today. Hope to have the results back by tomorrow, Thursday at the latest. You'll be getting this tomorrow, so we probably already have the results. And so look for a letter from Missy updating our residents and staff on the results and further direction, both from our medical director and the health department. So with that being said, we're not out of the woods as a country, as a community, as a county. As Governor Cooper, he kind of postponed going into phase 3. And a lot of times you're getting a lot of pushback from that as far as people, visitors here, they want to go out, they want to do things. But until we get a vaccine, until we are able to mitigate this, we still have to be cautious and take the actions that need to be taken. That means wearing face coverings, face masks. Please respect social distancing. Do not put yourself in situations of crowds. And remember, even if you're visiting with family and friends, when you're meeting with them, you're also visiting with everybody they've been socializing with. So if you know that your friends or family members or people are not really respecting social distancing or respecting the fact of trying to mitigate being put in a situation where they could be get this virus, you really need to stay away. And I'm sorry to say that, but it's going to take all of us to kind of come together to get through this, because at the end of the day, we do not want this in our community. It's been at West, and I give so much credit to the staff and the residents that are being good stewards of making sure through our housekeeping procedures, through wearing our mask, being careful of not touching our face, all this to try to just keep it at bay. So please, please continue to be good stewards until we get through this. And again, we're looking at 6 months, 9 months, God forbid, worst case, a year until we get a vaccine and we can get past this. So thank you for your diligence. Working together collectively, we shall overcome. So with that, I have to ask a big favor, and this is something I talk about a lot, but for both West and Guilford, please, please do not let people in the building unless they're coming in through the normal channels. Just today, I had a Spectrum person walking around, and I asked, how'd you get in? They said, well, one of the residents let me in. No, no. People need to come through our main entrance. They need to go through our protocols. They need to be checked for temperature. They have to fill out a form. We need to make sure that everybody coming in is being vetted. So I know we're nice people, and you don't want to say, I'm sorry, but nobody should be coming into the building except through the normal channel. So please do not let people in. Thank you for that. Okay, I'm gonna skip ahead. As I shared, I got 40 minutes before Zoom cuts me off. So I want to talk a little bit about some staffing and departments. Last time I spoke with you, I talked about some changes in environmental services. So starting July 1st, we have partnered with a component of Morrison called Community Works to oversee our housekeeping program. And so Alex Perez is now Director of Hospitality Services. Excuse me. And that came effective July 1st. He is working very closely with a national representative. Name is Jesse Cash. He has been making his way around both West and Guilford. He is working closely with our Environmental Services Department. He'll be here for 3 weeks, working very closely with Barbara and Bernadette, who are housekeeping supervisors, as we continue to roll out a very formal program as it relates to cleaning both of the apartments, common areas, common spaces. Very impressed with the program they have laid out. We're actually going to have Jesse come back probably for the September chat, so you can meet him. He can talk a little bit about the Community Works housekeeping program and what they do and why they do what they do. So very excited to see where we take this program. So with that being said, we're still on go to offering one housekeeping cleaning service to every independent living resident starting October. So Jesse is very positive that we can make that happen with the team. And as I said, they're working on training on the program as we speak. So for the next 3 months, they're working with our current environmental service team to get them up to speed and so that we can roll forward with this program. Another change that we're going to be seeing is our security supervisor, Alex McCarthy, has turned in his notice, and Alex will be leaving us within the next probably week to 2 weeks. For those who know Alex, he is a definitely stand-up young man, very professional, has done a lot for us in his tenure here. And in the interim, Marcus Lynch is providing us support services as Alex moves on. We will be bringing Marcus in to kind of help us as a transition, and he'll be filling that role of supervisor. As you may or may not know, over the last 2 months with the whole COVID-19 and our contract security and what they're willing to do as it relates to checking people in, we've been moving to more in-house security. So we're continuing to hire people that are Friends Homes employees. And probably by October, we will be all in-house with our security program. So more to come on that. Going from security to transportation, we just recently purchased a new bus, and it's currently getting new Friends Homes decals. So hopefully that will be put in commission. Even though we're not doing a lot of driving right now, we are looking forward to the day that we can be driving. So that bus hopefully will be on property within the next month or so. We're also looking at purchasing 2 smart cars for security patrol that will start patrolling the outside the campuses as they move around between Friends Homes West and Guilford. They will have markings that say security as well as the Friends Homes logo. So that should be hopefully in place within the next 2 months. Want to switch gears and say a big thank you to everyone that has been supporting the annual giving campaign, which supports residents' financial assistance. As of within the last week, I believe we're right around 57,000 of our $111,000 goal. So way on our way to being halfway. So thank you. Very excited about the participation that we're seeing this year. We've got some new people that are supporting this worthwhile campaign. We've seen people not only continue their support, but actually enhance and give a little bit more. So thank you. And remember, the $111,000, that number represents about 10% of our overall resident financial need. And so last time I tried to show you something. I'm going to try to show again. I'm going to try to share a screen of something that we are currently doing as it relates to tracking residents' financial assistance. So I'm going to be very hopeful that you can see this right now. This is a spreadsheet that I've been working with Ted Light on here at Friends Homes West, and it's kind of tracking our cost as it relates to residents' financial assistance, and then where the money's coming from to support it. So this right now is through fiscal year to date, June 30th. So our fiscal year starts on October 1st. And so as you look at this, right now through June 30th, we have unreimbursed calls for services rendered of about $667,000. And this is from residents who are paying something less than the market rate, if you will, for the units they occupy. The majority of these people are in our health center and are on Medicaid. And as I've shared with you before, Medicaid pays about 50 cents on the dollar of what it actually costs to provide the services. So as of June 30th, we've had about $667,000 financial assistance to about 18 residents. Through June 30th, we have received $95,000 for residents' financial assistance. Now, I know I just told you that we have collected about $57,000 for this year. You'll see that we received about $37,000 in December, which got applied to last year's campaign. But you see right here, the gifts are coming in. We started our financial annual giving campaign for 2020 in April. So we received 342 gifts in this last quarter at about $48,000. Right here is, if you recall, I've shared with you the board last year does have a resident financial assistance that's been board designated. They've earmarked for if you will, monies that they have collected over the years. They've earmarked that to support residents' financial assistance. And so they are going to allow us to start drawing down from that. That money has not been distributed yet, but down here in note 1, you'll see that that should be done by the end of September. And right now we're looking about drawing down about $300,000 to go to support. So that money coming in right now, if we brought in 300,000, we still are about 271,000 short through June 30th. This bottom part here, and I'll try to get this out so that this can be distributed as part of a resident council minutes as well. This bottom part here tracks the monies that have been earmarked by the board to support residents' financial assistance. And so right now you see that at the end of June, for both West and Guilford, we have about $12 million that is sitting and split between 2 financial advisors that is investing those monies. So we took a nice little hit in the second quarter, ending March 31st of the fiscal year, but the market did come back this last quarter. So I will try to get a copy of this to the resident council so that this can be part of the minutes, so you can see how we are tracking and trying to bring some transparency to overall residents' financial assistance. And you can see the support that you're doing goes right to that annual need for those residents we're currently taking care of. So thank you. So I'm going to keep moving on. I want to talk a little bit about phase 1, where we are. So if you're on the Guilford campus, we have been raising houses We are going to be starting on the other side of Ridgecrest here very soon. Fencing is up. The good news on that standpoint, parking we thought was going to be impacted soon, but it looks like parking is going to be impacted probably sometime in August. The Guilford people have been working very diligently on doing parking assignments. So we're going to go to a kind of a hang tag that will start allowing people to know which area they can park in. And we're going to have staff and contractors park separately because we just have enough parking really for our residents and limited guests. So stay tuned. Within the next 2 to 3 weeks, we'll have more information coming out about that, most likely from Ashland Smith. The parking will be limited when we start this in August, probably for 3 or 4 months. We'll lose about 40 spaces. We will get those back probably sometime around the end of October. Now over at West, you will notice that they're starting to work around the egress in the courtyard. They'll be putting up fencing in the main courtyard, probably starting on Wednesday, Thursday, Friday this week, and probably sometime toward the end of July, 1st of August. They are going to put up a fence that's going to close off the loop road. So as you come in the Friends Homes West campus, you can either go left or you can go right. Well, going forward, you can only go right, starting probably in late July, early August. There will be a small section of parking right in front of the 1000 building. So those residents living there can still go left and park, but otherwise all other traffic will have to go right. And if you want to park in the back, kind of behind the 5000 building over by assisted living where the wellness center is, you will have to go all the way around the loop road to park there. That road will be blocked off for about 12 months. So we're working on some additional signage, both for West and Guilford, to help direct us during this time. So stay tuned for that as well. Marketing for both campuses continues to go well, even in spite of COVID-19 and the limited access we have. We still have 19 of our 20 units at West spoken for. And then at Guilford, we're right around 35 of our 73 units. We're very excited we're working on getting some virtual tours for our villa apartments to help people kind of visualize what these apartments are looking like, but very excited about moving forward with that. At the West Campus, we're still looking probably at the 3rd week in July of the Wellness Center being closed off for the next 12 months. So Teresa Cox and Donna Sprinkle will be continuing putting words out about when the pool will be closed and the Wellness Center will be closed. Hoping to move some of the fitness equipment into our main living room at West. So that once the Governor Cooper opens up activities, quote unquote gyms, we can take advantage of that. So now what I want to do is I want to show another picture. I hope this works. This is a picture of our courtyard of the Wellness Center, and it's a bird's eye view. So when you look at this, this is looking down. So this right here is, if you can see my hand, this is the 1000 building. And this, you know, of course, would be the 2000 and 3000, 4000, and 5000. So this right here is where the Rose Garden used to be. So you will come in, there'll be a turnaround to take you to the new bistro, pool area, fitness aerobics room. We've got our clinic. We have arts and crafts room. We have a resident lounge, a beauty shop. But this is going to be the courtyard. And I hope you could tell from this, our courtyard is going to undergo a major renovation. We're going to have various walkways. We're going to have various seating areas. And we're hoping that we're going to be able to engage our residents to use the courtyard. And you can see the outline. This part right here, the upper part along the building, will not be touched. But about 2/3 of the courtyard is going to be totally re-landscaped, if you will. Now, right now, what contractors are doing, we're changing the egress currently, so the courtyard will no longer be an egress. So in case of a fire, you cannot use the courtyard as an escape. But they are going to create some viewing areas, so you will be able to go out and stand and watch the construction. But if there's a fire, you will have to go toward the front of the building and not go through the courtyard. So very excited about this. Again, this project should get kicked off here within the next 2 to 3 weeks, and it's about a 12 to 13 month project. Still waiting on getting some actual visuals of some work that's going to be done on the Guilford campus. We will be putting these visuals up so that residents can come and look at the boards so they can see what the final product would look like. What I'm hoping to do now is share one more picture. And I think I've shared this before, but I'll share it one more time. This is a rendering of the bridge that we'll be building over the next 2 years. And to kind of give you where we are, this is a visual coming from where this red car is. We're coming from the Guilford campus off Woodbrook and going toward the Friends Homes West campus. So Friends Homes West is kind of over here on the northeast side. The northwest side, these are a picture of the villa apartments that we are building. And then below, you'll see where this is going to be, hopefully in the next 5-10 years, is going to be the Greenway, the city of Greensboro that we're working with dedicating to them. So the bridge will go over the Greenway that the city owns and will connect up as part of their master plan. So very excited about this and the connection between the two campuses. Very, very excited. So I wanted to share that with you as well. Hopefully you saw it. So I'm going to continue going. I want to talk to you about some things going on from more of a high level standpoint. As you know, come November, we have our elections, and our Friends Homes Guilford campus is a voting precinct. And with all the construction going on, we are told right now from construction that all the parking should be back to normal by the end of October. But with not knowing what weather or construction delays, we don't want to assume anything. So Susie Hudson from the Guilford campus has been working with the Board of Elections, and they're working on backup plans, contingency plans. So more information coming on about that. Continue to promote absentee voting, early voting, to help us limit the amount of people that will be on our campus during that time. So just want to make you aware that we are working on that. Another big issue that's out there that really don't need the residents to do anything at this time is the North Carolina Leading Age is working very closely with the General Assembly to fight what's happening right now, where the Department of Revenue is trying to say that the monthly service fees that we charge our residents for independent living should be taxed as a sales tax because we provide services. So we're working through the General Assembly on that. We're making headway, but right now, just kind of stay ready. And when we get the word that we need to contact our various legislative bodies and stuff like that, we will let you know so we can do a writing campaign, a calling campaign. But right now, we're letting Leading Age kind of run with that, and they're telling us just to kind of hang tight there because it is being discussed. I want to switch gears a little bit now as my time is kind of running down. I want to talk a little bit about dining. I want to continue to say one, thanks to the team, the dining team. As I said many, many times, we did not have a playbook for COVID-19. And so the team had to come together and figure out plans on how do we get meals to our residents. And, you know, a lot of what we normally cook doesn't do very well when you're trying to transport or trying to hold temps or try to do mass cooking at one time to send out. The team has done a fabulous job of mentally and physically trying to meet the limitations that we have. Has it been perfect? No. Do we continue to try to meet the needs of the residents? Yes. And so I want to say thank you, first of all, for our residents, because this is obviously not our normal protocol or standard. And we too look forward to getting back to being able to serve in our dining room and be there when you're having issues or needs that we can address them at that time. One of the things is getting food to on a consistent basis at a consistent time has also been something we're struggling with. But the team's spirit and their attitude to not give in and to continue to work on it has been top notch. So for those of you that we're not meeting the mark or the expectations for that, I am sorry. I will tell you to continue to voice your opinions and your feedback. I do know that they are taken and that we will continue to work on those. And we too look forward to getting back to business as usual. With that, The team has done a great job looking on how we handle all the styrofoam we've been using. We were looking at going down a road of utilizing some takeout containers. From the old days, I call them Tupperware. And we're kind of taking a different approach. The more research we did, we realized that those two are made out of plastic, and the longevity of those products, the accounting of those products, the storing of those products, talking to other people that use them, we are realizing that it's going to probably cause more frustration than is worth for us and you. And so we are going back to utilizing a product that's more eco-friendly and is compostable. There's a cost that comes to this, just like it did with the Tupperware option. But we believe long term, for the good of the environment, as well as logistically and monitoring, that this is the way to go. So we're looking at moving toward using a compostable product that we are going to try to roll out here very soon. We know we're going to go up for our employee meals for takeout, and most likely we are going to have to go up and do a charge for our residents who decide to do takeout. It looks like it's going to add about 50 cents to 75 cents. It's actually a little bit more than that, but we're going to absorb some of that through our operating costs. But about 50 cents to 75 cents is what it's looking like for those residents that are going to be doing takeout. Now, that's not during COVID-19 because right now you don't have an option. But at the point we do get back to where the dining room will be open and we can serve, we will then, if residents decide to choose takeout as an option, there will be an add-on charge on top of that. So I need to work with the resident board and to talk about that, to get their feedback on that. But we do know that we are going to move away from the Tupperware, because at the end of the day, from sustainability, we are not feeling comfortable long term, and we think that going to compostable is the right answer. So need to follow up with that, but I want to put that out there so y'all can start soaking on that and give us some feedback and your thoughts on that. The other thing is, we've talked about this a lot, this concept called Avenue C, which is like a convenience store as it relates to dining. I know at West that we're looking, I think August 8th, when that is going to be put in place in our resident lounge. That's the last time I heard, last update. At Guilford, it should be fairly close around that time frame. And again, this is something where you can use your badge. It's not part of the meal program, so it doesn't go against your meal credit, if you will. But you can use your badge, and if you buy something from the canteen, it will go on your bill, and then it'll just become part of your monthly bill. So from that convenience, if you're in the middle of the night and you want a sandwich, or you want to grab a Coke or a Twix or whatever, you could go here, grab it, and not have to worry about it. It takes credit card. You can use your badge for your meal account. So very excited about that. That's been a long time coming. So hopefully early to mid-August, we will see that roll out. So as always, there's probably a lot of things that I missed, but I do want to end on a note of, again, this is a resident-led employee appreciation program, is a resident-led program. I have nothing to do with that other than to say thank you for what you do to even have this type of recognition program for our employees, our frontline staff. Especially as I continue to look at what they're doing every day as it relates to COVID-19, what we're asking them to do to limit their exposure when they go back out into the world, to come in here every day, to stay strong, to push through just like you're doing. I just want to give a shout out for any support that you give to the Employee Appreciation Program, because I know what it means to the staff that take care of you and do this, and how much they appreciate you sharing your treasure. Since we do not accept tips, this is a way to acknowledge and thank them for their service to you. So just want to again acknowledge that, because I know that program is getting ready to get kicked off at both campuses, and just want to say thank you. So as we continue to move on, I want to say stay strong and don't lose your resolve. We will get through this. Continue to to let us know where we're falling short. But at the same time, don't hesitate when you see someone that goes above and beyond to acknowledge that, to thank them, because right now we all need a little pat on the back, and especially our staff. And we know that with our residents and the isolation and the lack of activity, it's taken a toll. And so I commend the team for trying to find ways to still connect our residents, especially in our healthcare, whether it's through Zoom or we're looking at virtual reality, just trying to make sure they know that they still have a purpose, and that they're loved. And so if I will share with you, if you reach out, even through phone calls or whatever, to just give words of encouragement, reach out to a neighbor or a friend, just to make sure you know they're not alone. And together we will get through this. So God bless you all. Thank you for all that you do. And thank you for being residents of Friends Homes. I will talk to you soon. Bye.